want to thank Sovereign Health and all the participants in this webinar and those who might be listening in later for participating in this, and also want to apologize. Wouldn't you know it, 5 minutes before we're scheduled to start, I get the blue screen of death. 5 minutes before we start. So these things happen, and I do apologize for the inconvenience and the time crunch that we might have to deal with now. So what this workshop is about is presenting an idea, and that is to think differently about how we approach recovery from substance use disorders and behavioral process disorders. The missing piece is a relational approach to recovery that accounts for each person's individual recovery and the relationship recovery, because we know there's a reciprocal bilateral impact between relationship health and recovery, successful recovery from substance use disorders. And the systemic perspective also includes an awareness of societal, cultural, political systems and considerations, because how disorders are classified really determines levels of treatment and accessibility. So when a substance use disorder is criminalized, then the treatment of choice is incarceration. If a substance use disorder is viewed as a disorder in need of treatment, then the treatment choice is appropriately going to be recovery. So I'm going to start by giving some stories, real-life examples of interactions I've had with folks that will hopefully underscore why I think couple recovery is so important. So I got a phone call from a woman whose husband was in treatment in a program, and he was not living at home. He had been in treatment for about 7 months at the time she called, and she expressed terror at the thought of him coming home. Probably her level of involvement with recovery at that point had been 2 groups that she had attended in this treatment program, and on codependency and understanding addiction as a disease, and a support group for her as a partner of somebody with a substance use disorder, and encouragement to go to Al-Anon. She expressed great concern that she was open to those things, but feeling at a loss for how to actually manage the relationship and how addiction had impacted them and recovery had impacted them, and there was nothing really offered for her. Second story, I spoke with a colleague who was treating a couple where the husband was a self-identified sex addict in treatment for sex addiction and was attending a treatment program on an outpatient basis, and was literally told by the treatment program that he should not be doing couples therapy, and that if he did engage in couples therapy, he would be discharged from their program. They felt that strongly about it, which was a huge dilemma for everyone involved here. And so my colleague was basically continuing to work with them in spite of this, because they were getting great benefit out of the couple's work. Third story, I was at a luncheon sponsored by a treatment program, not Sovereign Health, for the record, and the speaker was an interventionist who was talking about how she had worked with the family and eventually got the wife who was had alcohol use disorder into treatment. So that was all good. And then as she was telling the story, about 4 months into recovery, after she got home from this residential treatment program, the wife, that is, called the interventionist and in great distress, saying that their relationship was in serious trouble, that while she wasn't drinking, there had not been an issue with relapse, they were struggling, the stress was just overwhelming both of them, and could she, the interventionist, refer them to a couples therapist, and was advised by the interventionist who told the story that it was contraindicated to do couples therapy at this point in her recovery, and that they needed to wait until recovery was more established. Now, I think that's problematic, and let me tell you why. What we're communicating is that we have an issue that has impacted you in pervasive ways, individually and your couple relationship. And in the heart of sort of addiction pathology is the inability to talk about and express what you see and what you need. It's just not possible in an addicted system. When individuals get into recovery, we are inadvertently reinforcing the don't talk, don't trust, don't feel, and having people on separate paths. So I'm going to give you an example of an email I literally just received yesterday. And this is from a woman who states she is in serious long-term relationship, had got together with her partner in NA, Narcotics Anonymous, in 2012, had been clean a few months, then used harder than before. We are now in recovery, she writes, but there are no resources to help us. We've been advised to end our relationship, and she's writing to me, you are the first person to give us hope that we can make it together. We are dealing with the wreckage of our past while having no coping skills. I would love to be a part of Couples Addiction Recovery Empowerment, which is a movement of advocating for couple recovery. If you have any reading suggestions, ideas, worksheets, anything, it would help. So thinking about recovery from a different perspective that would include a relational perspective is really looking at what we can do to help integrate individual recoveries into a family life so that ultimately there's a sense of couple recovery and relationship recovery for everyone who lives in that house or is interacting with a person with a substance use disorder. Now this idea is actually not new. So I'm going to give you a very sort of brief historical perspective on what started way back in the 30s, where family theories regarding alcoholism go back that far and really emphasize the symbiotic relationship between the alcoholic and the spouse. At that point, the only people in studies were male alcoholics, so apparently they thought female alcoholics did not exist. Their role was to be the enabler. So unfortunately, there was a tremendous amount of blame given to the family and particularly to the wife at that point. Then we look at the advent of new psychoanalytic, social psychological constructs like Adler, Sullivan, Horney, Fromm, and they really highlighted social and interpersonal dynamics and sort of heralded the family therapy of the 1950s. So it led to an interest in the spouse of alcoholics. So it's sort of the beginning of looking at a relational approach. Then in the 60s, of course, we had the advent, much of this originated FMRI, with the family systems approach of Bowen, Jackson, Mnuchin, Haley, Ackerman, but they pretty much ignored alcoholism and viewed family pathology from a systemic perspective that didn't uniquely identify alcoholism as something to identify separate from the systemic problem, period. The first systemic paper on alcoholism that I found anyway was in 1968 by Ewing and Fox, and now what we're starting to do is integrate some of the systemic stuff into an alcoholic concept, alcoholic systems concept. So alcoholic marriages were established, for instance, they would write, to resist change over time. Ewing and Fox wrote, passive dependency of the alcoholic elicits wife's protective nurturing needs. But the good news is that alcoholism is no longer seen as just an intrapsychic dynamic, intrapsychic. It's seen as an interpersonal dynamic. And by the way, in the 50s, Whalen wrote the first, 1953, she came up with a typology, of partners of alcoholics: controlling Catherine, wavering Winifred, punitive Polly, and suffering Susan. So we have this sort of these pejorative labels to the partners. But again, the good news in that is that at least we're looking at alcoholism as a stabilizing influence or system maintenance. So it's as if there's secondary gains from this alcoholism. Of course, this is before all the neurobiology stuff that we know now, and was pretty much a systemic frame, kind of excluding other possibilities, really. But all families are operational systems, Steinglass would write, and drive towards homeostasis and organize around drinking and feedback mechanisms. So it's kind of interesting to take this idea that alcoholism as a stabilizing influence and replacing that with perhaps recovery could be a stabilizing influence. Because here we have the elephant in the living room, which is the proverbial alcoholism or substance use disorder. So when I say alcoholism, I'm referring to any substance use disorder or behavioral process addiction, and it not being acknowledged. And the problem often lies with the idea of stigma and the moral model. So it turns out that 33% of the public believe that recovery from mental illness and addiction is actually impossible. It cannot happen. And 1/3 of MDs report feeling uncomfortable even asking about or talking about drug and alcohol abuse with patients. So we've got this incredible stigma attached to this disorder. And sort of there is hope on the horizon because there's this organization and a movement called Many Faces, One Voice. It's a collaborative effort in this growing movement to battle the stigma and discrimination of addiction and treatment. And the movement was launched with the release of a feature documentary by filmmaker Greg Williams, and the documentary is called Anonymous People. If you have not seen it, I highly recommend that you check out Anonymous People. Last time I looked, it was on Netflix, so if you have that service, that would be in the easy access. And basically that documentary tells stories of hope and inspiration, illustrating what people do in their recovery and that are no longer using. William Wright, who's just a profound researcher, prolific and profound in his work on addiction, has been studying it for many years, and a fine researcher and theoretician, writes that a new recovery advocacy movement is spreading across America, leaving in its wake a new generation of recovering people and their families seeking new ways to carry hope to those still suffering. So we have to assume that when you're working with a couple or a family, this is going to be a shame-based family system. So it's important to let them know recovery as a movement. That are 23.5 million Americans that do live in long-term recovery, and 10% of Americans reportedly are also in recovery. And we have a pervasive problem that needs to be identified. But here's the thing. Remind me, why don't we see couples in early recovery? So when we think about what we communicate to partners when their partner finally gets into recovery, or the person gets into recovery, and we say, now we'd like you not to talk to each other, because what leads to recovery typically is a destabilization of the couple's system, period. They've organized around alcohol or the substance, whatever it is, and now recovery is a destabilization of that process, and we're leaving them at probably the most vulnerable point when we're saying we're denying services to a couple when they need it the most. And we go, well, I kind of wondered. I mean, I had been working in the field a while now, having worked in chemical dependency since '87, and I was former clinical director of a drug treatment program, and so that was kind of the prevailing theme. You know, you need to establish your individual recoveries before getting to couple recovery. And I understand the thinking, because the notion is that, you know, you might become destabilized if there's too much stuff in the interactional therapy that might be going on. The problem with that thinking is that the problems are there already. And so as the person who emailed me addressed, we want to stay together, but we don't have the resources, we don't have the skill set to manage the emotions we're having, to support each other in recovery, and to build recovery into a relationship. So we've got that same elephant that's showing up, only it's not alcoholism or substance use disorders or process addictions, it's recovery. It's the thing that we're communicating. You cannot talk to your partner about what's going on. Stay on your own side of the street. Yet we have these problems that are just rampant within the relationship, and we don't know how to help them. So I really wanted to work with this idea of, well, where did we get this idea that we shouldn't work with couples in early recovery? There must be some science underneath this. Turns out I couldn't find any. Maybe it's out there, but I couldn't find any. There are no empirical studies to support the long-standing belief to avoid couple therapy in early recovery. So how did this model evolve? So I want to show you a couple of things about these are just sort of prevalence numbers, because this is to kind of underscore just how pervasive this problem is, which is not maybe shocking to most people listening to this webinar. But let's just look at a couple of these and highlight a couple of these. That 2/3 of American families are impacted by some form of substance use disorders. There's a lifetime prevalence of 30% in America of alcohol use disorders. They may not maintain that diagnosis over time. In fact, most don't. At the lower end of symptoms, when we look at the DSM-5, they're at maybe 2 or 3 symptoms. So that may not be a diagnosis that sticks, so to speak. The other bullet I want to highlight is that couples with substance issues are 4 times more likely to divorce than any other demographic. So clearly we're not getting to these couples in time to begin to mediate against sort of the baggage of this addiction past, and that they're bringing into the present and certainly will impact the future. We also know that there are 22 million Americans who've misused prescription painkillers, and that prescription pill addiction has led to the current heroin epidemic, as people are finding options to keep that opioid level high. We also know that 68% of individuals 12 years and older get a hold of painkillers for non-medical use from friend's medicine cabinet or from a friend or family member. At one point, there was enough opioid pain pill medication to give everyone in America a bottle of opioids pills. It's kind of remarkable, just that in itself. Emerging alcohol problems, we look at just the high rates of drinking too much. The almost alcoholic categories kind of emerged in the last year. 30% of Americans do drink excessively. Turns out that of the 90% of people who binge and are heavy drinkers really don't qualify for alcoholic. And here's a little cartoon sort of underscoring this notion. Studies show that drinking moderate amounts of alcohol can lower the risk of dying by 25% compared with those who rarely drink. And the fellow at the bar says, well, if moderate's good, then excessive's got to be great. So there's some studies, and this is even controversial, that would indicate alcohol may kind of mediate against some heart problems at low levels of drinking. At high levels, then the risk goes up exponentially. So here's the model I'm wanting to talk about today, and it's looking at what recovery paradigms we have might not be the most helpful. If we're limiting recovery to individual recoveries only and postponing a couple's approach until it's really too late. So individual recovery needs to be supported and reinforced in every way. And recovery is going to be defined by each individual. It may be a mutual aid group, it might be therapy, it might be yoga, it could be whatever that is for that person. Couple recovery is a relational approach that takes into account each person's recovery. So we've got these, if it's just a partnership here, we've got a couple, that is, we've got 3 recoveries to consider. Each partner's recovery and the relationship. That's the notion. So couple recovery, it's time, and this is a big paradigm shift. I want to refer again to William White and his definition of family recovery, which is, I think, a brilliant definition. So William White describes family recovery as a process through which family members impacted by severe and persistent substance use disorder problems individually and collectively regain their health. Family recovery involves enhanced health access with 3 dimensions: individual family members, family subsystems, and family as a system. So there's, and this is built into my model, a redefinition of roles, boundaries, rules, rituals conducive to healthy boundary transactions. The recovery of an addicted member can destabilize and threaten the survival of the family without health, and vice versa. So in this redefinition of roles, boundaries, rules, and rituals, it is easier, and this is a Gottman frame too. I'm a Gottman therapist, as you know. We look at what's called state-dependent learning. So when you've got a couple in front of you and we have a partner who starts getting overwhelmed and starts moving into what could be defined as a codependent movement, then the therapist at that point can work with that emotion and give alternatives. And I'm going to give you an intervention that you might want to consider in those situations. And what you're helping people to do is, in that state-dependent learning mode, is to experience this pull towards codependent-like behavior, saying, here's what you can do instead. So here's a study that is an important study, I think, to know about by Humphreys, Moos, and Cohen. And conclusions from this study were that short-term interventions have little long-term impact. So what we're talking about is this reiteration currently, really, that looking at addiction for that 5 to 10% in, you know, the severe level of alcohol use and substance use disorders, at that end, short-term interventions have little effect. Long-terms are what's helpful. And here's, I think, a big pitch for the relational approach at the most predictive of remission. You have to think about that for a second. So what the study indicates is that when couples are on a steady path, then they're actually, the odds of sobriety go up, which makes perfect sense when we think about that reciprocal relationship between relationship health and sobriety and the ability to maintain sobriety over a long period of time. And this study is significant because it's a pretty good sized cohort, and it's one of the few outcome studies that looks at an 8-year follow-up, not a 12-month or 16-month or 18-month follow-up. So this is important information to pass on to people. Outpatient sessions sought in the first 3 years increase the likelihood of remission, so continued support. And then AA participation in the first 3 years increased the likelihood of remission, meaning they stayed sober, at 8 years. And they're asking specifically about AA, and this would be an assumption, but I'm assuming it's likely that any mutual aid group or any support system that is going to increase sobriety in the long term. And I think that's really what we're looking at. It's about relationships. So this movement that I coined, CARE, which stands for Couples Addiction Recovery Empowerment, is an advocacy for couples recovery to say, let's challenge our current paradigm that excludes couple approaches and advocate for that to increase the chances of increased sobriety and to validate individual and couple recovery. They're not mutually exclusive, and couple recovery should not replace or even attempt to replace individual help. And to normalize from recovery, incredibly painful for individuals and certainly for couples, and that most relapses take place in that first year, most likely because of that. So couples need a roadmap. What call or that email from that woman knowing what to do. So my research out of a Mental Research Institute followed a focus group of couples it was a qualitative study looking at what are the themes that emerged over time. So there was a minimum of 5 years of recovery at the time of this focus group, and then at the end of the focus group there was over 10 years of continuous sobriety and other basically main concepts. And so what we have here is this couplet, I call it. And there are 3 components, and like a Gottman frame where we have different components of relationship functioning, it's not hierarchical, it's not linear, it's a nonlinear thing. So if you kind of think of a mobile, you're hitting one part of this and the others move in response. So there's discrete components of recovery development in these relationships, but what we're having is an interaction between these 3 that one affects the other. So here's what they are. Shifting refers to this shift, a dramatic movement towards a couple relationship. It's moving out of individual recovery only and beginning to develop an identity as a recovering couple. So it starts with this awareness. Now the problem is that many people and many treatment programs and many support groups would discourage this identity until somebody has well-established recovery, as I've said several times now. The approach here is that what I learned from the couples who have kind of figured things out is that when they began talking about their relationship in the context of recovery, then they began to deepen their own individual recovery. That's that interaction between recovery, health, and relationship health. So we can kind of help these couples move in a different direction because you're going to give them the tools. Intergenerational reworking is a kind of a laborsome term to get out there, but in my research, this was the single biggest component, or I should say code, really, and it really relates to the impact of the family of origin on relationships. That as partners began to change their relationship, they really began to deconstruct their family of origin experience through new filters and basically had redefinitions of self and relationships, and even their relationship to recovery and to the substance. So when you integrate some of their family of origin stuff into the couple's work, you understand why they're reacting and what your new tools don't work. And attending, and it's pretty much a definition of what I would call interdependency, which means it's the ability to care for self and to address relationship issues, that they don't have to be sort of opposite ends or can't be held at the same time. And this gets down to how you help couples establish what's healthy for them as an individual so that their couples work doesn't interfere with that growth and that recovery, if that's how they're defining it. We have another cartoon where the mother states, "Are you going to trust your father's selective memory over mine?" And a lot of my work with couples really does reflect in their family of origin stuff that now comes out, and a deeper understanding of that work really helps people to put together a recovery that works for them both individually and as a couple. So one of the typologies that's a better one than the punitive poly and suffering Susan version for couples came out of FMRI, Mental Research Institute, and worked with Stephanie Brown and Virginia Lewis, who were co-directors of this recovery project, to determine what happens to couples and families over time. So came up with this typology. They came up with this typology. A type 1 couple would be when both partners are in recovery, but they're in separate recovery programs. So we might have the person with a substance use disorder who attends a mutual aid group of some kind, or therapy, or some other version of recovery, and their partner is doing something as well. A type 2 couple would be when only one partner is in recovery and the other isn't. That could be the person with the addiction, with a substance use disorder of some kind, or it could be the partner. And type 3 is when neither's in recovery. It's the proverbial dry drunk or white knuckle sobriety, when the person basically just stops using but doesn't change anything else in their life. And so if you've done any counseling at all with individuals who've had problems with substances and behaviors and don't really do anything other than just stop, you'll know what that feels like. And basically dynamics and the interactional patterns don't really change any. So a relational approach is the option that I'm really proposing, and that there are 3 levels of recovery addressed. So it's a reiteration of what I said earlier. The person with the substance use disorder or behavioral dysregulation, like sex addiction of some kind or overeating. So we're going to incorporate that in a therapeutic context for the work. The partner's recovery, however they define that, and then the actual couple recovery. What I'm proposing is a new typology, or an additional piece added to the current typology developed at FMRI, and that is to look at a type 1 plus, which means both partners are doing their individual work and however they define that to work on their recovery and however they define that, and they're working on integrating that recovery into their coupledness. So I want to go on and just give you some interventions. Now, the goal for the workshop is to identify the 3 components of successful recovery. So we have that shifting is the first component I just spoke about, and then intergenerational reworking is integrating things from the past, from the family of origin, into the recovery work, and then attending is helping partners stabilize their own recovery in the context of the relationship so they can actually support one another. Now, all all addiction work needs to be trauma informed. So the first intervention I want to show you is called Hart, Healing Emotions from Addiction, Recovery, and Trauma. Now these interventions emerged out of some pilot studies or pilot groups I've done way back in 2003 at this point, where I did kind of like a focus group with therapists where I was trying out some of these interventions and having them respond. This was at Santa Clara University. Then I presented a workshop with John Gottman in Seattle where we integrated these interventions into a workshop for not just therapists but for recovery addiction professionals. So these were non-therapist types to see, is this language and an approach that non-therapists would feel comfortable with and use. Then I had the opportunity to present these interventions in a 2-day workshop for couples in an actual clinical setting, which included a treatment program in Southern California and a treatment program in Northern California. And then I've also presented this workshop in, twice now I was invited by Rainbow Treatment Center in eastern Arizona to the White Mountain Apache tribe, whom they provide services to. And this was part of a 3-day couples retreat. So the workshop was interspersed with things like horseback riding and other activities that were fun and a banquet and so on. It was just a very powerful experience for me, I have to tell you. And integrating all of the tools that I've developed in collaboration with the Gottman Institute and John and Julie Gottman, and found it to be very powerful and helpful. So I had a population in the White Mountain Apache tribe who I was told, I did a lot of Skyping training with staff before I showed up to find out and understand more about the culture and to let them know what I was going to be doing, and found out that the experience was very, very positive at the other end. And I would have some of these couples come up to me and say that they've been able to talk about their addiction and recovery for the very first time ever because there's this structure. So one of the most powerful interventions I've done with couples is this Hart. intervention. So it stands for Healing Emotions from Addiction and Recovery Trauma. So the way this is structured is we have a speaker and listener. And what I do is I tell partners to say, I'd like you to take one aspect, one memory, one event in this addiction history that you're going to share with your partner, the impact of that event on you. Now, I take a lot of time to structure this, and it's going to be hard to cover how thoroughly I do that in this brief webinar, but basically we stay out of blame. I kind of do a narrative approach that say, think of addiction as something that's invaded your relationship, and it's an uninvited guest that now parked in your relationship, and it's affecting you, partner one, it affected you, partner two, and it affected your relationship. So what we're going to do is create a way to talk about that without blaming and shaming the person with the substance use disorder. So in the workshop, I actually have a series of questions that I have the listener ask the partner. Now, I did this with a couple. We were 4 months into a therapy process. He had about 6 months of continuous sobriety at that point, and his wife had found out about sex addiction as kind of a recent addiction that she didn't know about, and we did this process. Now, he actually had less than 6 months at that time, and with a lot of support and a lot of reinforcement for why we're doing this, they were able to talk about a very painful subject that begins to lift some of the trauma, so it doesn't become the elephant in the living room. So with a lot of structure and a lot of support, you can have couples actually talk about trauma. It was a very poignant moment when I had done this intervention in Southern California, and the person with the alcohol use disorder was describing an event that he experienced during one of his own blackout phases and how traumatic that was for him. He was in tears, and for the very first time, I'm thinking, his partner saw the impact of his addiction on him. I don't think it often occurs to partners to think in that way. So by externalizing this thing that's invaded the relationship, both partners are able to talk about it and to acknowledge the pain from the past so that they can actually move forward. I'm actually giving you 5 interventions, and I'm going really quickly through them. So there was a lot more I could say about that, but I'm not going to because I want to throw in these others before we end. The other set of interventions, there's actually 3 that I'm going to tell you about, total of 4 in the workshop and in my individual work, called Building Recovery Maps. And what that means is, can we talk about what's happening for you, what's happening for me, and what's happening for us in a constructive way that acknowledges the reality of addiction and the reality of recovery in our lives. And so the structure for this is to provide a way for partners to set boundaries with they're comfortable and not comfortable with talking about. And the goal is to deepen understanding and compassion for each other. So I have a very detailed sheet that I hand out to partners. Say, well, here's what validation means, here's what empathy means. If you can't do this, we'll talk about it, we'll process your feelings as we need to. But this has ended up being one of the most powerful interventions. And I've done a lot of trainings in the last year and actually presented nationally. And so the connection actually, even with presenting this webinar, is Sovereign Health was one of the sponsors for a workshop I did in Orange County in March. We had 100 therapists attend. There's a manual. Here's what you give your clients. Here's how you can facilitate a conversation about something that they've never been able to talk about. So it starts with the first intervention I want to talk about with this recovery map is my recovery or my wellness. Now, some people, particularly partners of the substance use disordered person, don't identify recovery, but they could identify with the word wellness. And here's the structure of the exercise. I actually have a card deck I've developed where partners can pick out of a number of cards something they want to tell their partner. And the concept is, you don't need a card deck to do this. It just helps. What is important for you to have your partner understand about your recovery? What is important for you that they understand about what's going on for you right now? And again, you're helping them create healthy boundaries, and we're helping partners just to listen, to avoid problem solving. If it starts moving into something that gets a little fuzzy boundary-wise, then you move in and help them stick with just understanding. So the intervention could be simply this. Right now, could you just listen? And the goal is for you to understand. I know you have feelings, and we can talk about that. But if you can, stay in the listener role. And there's questions like, what I want you to understand about the work I am doing, one way I think I have changed since recovery is this, what I hope to learn or change about myself, what I'm grateful for. So we're not creating recovery as the elephant anymore. We're saying, I am in recovery, and here's something I want you to know. Or I am working on my wellness, and here's what I am comfortable having you know about that. So this really is about boundaries and state-dependent learning. To be frank, officer, my parents never set boundaries, but the therapist counselor can help do that when it feels confusing to partners. Intervention number 2 from the recovery map combo is getting more controversial, I think, and that is to actually ask the partner something about their recovery that you don't understand and we would like to better understand. So the intervention is, what would you like to ask your partner about their recovery? If your partner isn't comfortable then with that question, then ask another. And reinforce boundaries, give permission to pass on the question, or to say, I'll stop right there. So what I've discovered is that when there's curiosity or misunderstanding about recovery, it's just better to kind of put it out there. And you can help partners set the boundaries about how much is disclosed, but it doesn't, again, become the elephant. Then the third recovery map intervention is called Our Recovery. The therapist asks if the couple would be willing to talk about the impact of recovery, not addiction, on the relationship. So the facilitator can say, let's see if you both can agree to talk about an issue related to what's different for you as a couple since starting recovery. So it would be questions like in the suggestion list I have. They come up with their own. But what role have support programs played in our relationship? How has our relationship changed since recovery? How do you think we've changed as a family? What does the term recovering couple mean to you? So you have them just process these things. Again, we're taking it out of the dark and talking about something that is so relevant to both their lives, and to create a way to have this discussion probably for the first time. And so with this comes the admonition, don't problem solve, focus on listening, just understanding. And then there's other interventions that you can do following this kind of thing. But right now we're just putting it on the table. Then finally, the last intervention is this concept of defining interdependency. So the word dependency sometimes scares people because it sounds too much like an addiction or codependency. But all healthy relationships need to have a level of interdependency, which is defined most basically as the ability to trust that it's okay in the relationship to say what I think, I feel, and I need. So if I can do that, then we are beginning to strengthen interdependency, which is a healthy alternative to codependency. So codependency, everyone will have their own definition, but generally it's oftentimes considered a blurring of boundaries, an inability to express one's own needs, this assuming control in areas where you really don't have control, and just a tremendous amount of anxiety and anger that is sort of pervasive in the relationship. So what happens when partners feel anxious in the relationship? Do we automatically call that codependent? What happens when their partner in recovery comes home 5 minutes late, 10 minutes late from a meeting, and they're panicked inside because they're wondering if they've relapsed? So is it codependent to have that feeling? And if we had more time, I'd talk more about this. I don't think that's codependent to have the feeling. I think that's probably post-traumatic stress disorder. And here's where you can help people name the feeling, focus on themselves, and stay out of unhealthy behaviors. So here's what I call the 3 boxes, basically, intervention. And it's pretty straightforward. Theoretically, it's straightforward. You have to implement it. It's going to take some creativity sometimes. But you say, you know, there's the codependent response, and then there's the interdependent, which we're aiming for. Codependent would be moving into control, and the other things I said, and other things you might want to add about that. Expressing concern is merely expressing concern. So when the partner comes home and looks red-eyed, has red eyes, I should say, I don't think it's inappropriate to say, you know, I have to tell you, I notice your eyes are red, it makes me anxious, and kind of let it go at that. And I don't think there's anything wrong with saying, I need to know, have you used? I don't think that's codependent. I think it's naming what you see in front of you. Or I'm concerned when you told me that you're cutting down from your meetings from 5 to 4. I'm just letting you know I'm concerned about that. However, it's your program. So this is where the facilitator can say something like, it's okay to express emotions. You can't work the person's program. And then I also think it's healthy to offer support. Is there anything I can do right now to help you? Well, when I come home from a meeting, if I could have like 10 minutes to decompress, that would be helpful. Okay, I can do that. Hey, I'd really appreciate it if you bathe the kids on Wednesday nights. Ooh, that's bumping into my home meeting, so how about Thursday nights, some other night? So ways to offer support, you can help couples establish boundaries. And I'm close to stopping at noon, so Shruti, I'm not sure if we have time for Q&A or if we need to stop at this point.
Yes, we have got some questions here. Thank you, Dr.
Okay.
Novara. That was amazing. And thanks for the great presentation. Okay,
Thank
we're
you.
now going to start the question answer round. Just as a reminder for everyone attending, please use the chat box to send in your questions. There's a question from Darlene. What do you say to a couple when initially or after a few sessions, it's clear that the addict is still using and not very motivated to stop?
Yeah, that's a really good question. So this presentation was about once the couple gets into recovery, and so these tools and techniques are not things I would use when the addiction is still active. This is the post that. But when there's evidence of misuse and problem use of some kind, then what the research indicates is that couples therapy is one of the most effective ways to help move people into recovery. It's more effective than individual therapy. So it's noticing and commenting and allowing people to express concerns. I had a couple come in where in their first session she was complaining that he wasn't a good listener and wasn't helping with vacuuming, and he was complaining about her being controlling, and then she goes, well, of course I am. I found a vodka bottle behind the toilet. And I said, well, let's talk a little bit about the vodka bottle behind the toilet. And through a series of sessions, eventually he saw that that's a problem and got into recovery. And you're more likely to be successful, I think, if you can try the couples approach. That's what the research would support.
Moving on to the next question from Robert.
Okay.
Curious about Dr. Novara's thoughts about the impact of post-acute withdrawal syndrome on relational interventions.
Oh, right. Sorry. All right, so post-acute withdrawal syndrome.
Yeah.
Right. Well, yeah, all these things have to be taken into consideration. So as we know, it takes the brain a while to stabilize, weeks, months, sometimes even longer. So is somebody actually ready for this kind of intervention? And it's kind of interesting because when I worked with my couple he had about 4 months of recovery at that time of continuous sobriety, I think there was some level of post-acute withdrawal still going on, but we were able to process to the degree that he was able to some of his partner's emotions. So there is that, and these are not one-time conversations. It's also setting a precedent to say if this is a good thing for us to talk about. I also set it up so that if you feel overwhelmed and feel like you can't go forward, then let's just stop the intervention. Let's just stop this exercise right now, and we'll deal with that. So there's always a way. You don't exactly know, if something's going to work for a couple. But that's with any intervention. So when there's evidence that it's not working, you stop it and you process. But the goal is to help them talk about their feelings, so that's a good thing too. I think that's all I'd say about that for now.
Okay. Thanks, Doctor. Moving on to the next question from Anthony. Where in the care typology would we categorize a couple where someone is in recovery and the partner has relapsed and is restarting recovery?
Yeah. So if the partner's relapsed, then and is starting recovery again, I would still put them in a type 1, which means they're both in recovery. They're just sort of rebooting and revising. And we need to talk about, and that's actually one of the things I talk about with my couples when they've established recovery. Let's talk about what would happen, God forbid, if you were to relapse. What are your expectations? What are your expectations as the partner? And so anticipating and putting a plan together to anticipate sort of the worst case scenario is a really good idea. But if they're both willing and committed to recovery at that point, especially the person who's relapsed, then it would still be a type 1 couple. If the person says, well, I don't think it's that serious of a problem and kind of minimizes, then I would say we have a type 2 couple, and then the interventions are aimed at trying to break down that denial and use a motivational approach perhaps or stages of change approach to kind of help see the impact of that. Always there's going to be a sense of shame, oftentimes in recovery anyway. And so if we get to that and do some work around managing that shame, then I think it's easier to break that denial down.
All right. Another question from Anthony, same. Where can we find more information and instructions on Hart methodology?
Yeah. So I'm doing workshops through the Gottman Institute, and so we have a couple left this year. I'm going to be writing this up and trying to make resources available. I also have a Facebook page, it's Couples Recovery. It's a professional Facebook page. It's called Couples Recovery. And so I'm trying to share resources through the Facebook page as well and really develop this idea. And I'm going to be doing a randomized clinical trial in treatment programs to establish this protocol. So I'm hoping to write this up and make it more available. That's why I so appreciate the opportunity to share some of these ideas even at this point.
Thanks. And moving on to our last questions from Solil. Any thoughts on being sexual or when to be sexual between the couples?
Boy, that's a great question too. So, the research indicates that I've seen is that there is not a couple who's been through addiction that has not been impacted profoundly in their sexual relationship. And so much of it can tie to, trust, intimacy, so much ties to associations with use, and what does it mean to actually have sex sober from whatever. So it's a process of developing trust. John Gottman's done a lot of work, John and Julie Gottman have done a lot of work on establishing a healthy sexual relationship, and it really begins with conversation, and it begins with being able to talk about needs and also talk about feelings that have been triggered in the past around sex. So it's something, I kind of see therapy, couples therapy, as creating a platform for couples to talk about things that they can't talk about otherwise. So it isn't always about establishing intimacy. It's with couples in early recovery, it's not likely to be that. Decisions to manage their sexual life, to begin to address it. And it's the beginning of many conversations is what I would see this process is involving. But you're providing an environment, and you have to always think of the alternative. So if we're not providing an environment for these couples to talk about sex or to talk about their challenges or their traumas, then what are we leaving them with? We're leaving them with nothing. So under a structured, supportive environment, I think couples are more apt to have these conversations and eventually kind of move through recovery a little bit smoother than they would otherwise.
All right. So keeping the time frame in mind, we have to end this session right here. Thank you so much, Dr. Nuwara. A really good job and great answers. Thank you so much for the presentation.
Thank you so much. Thank you for everyone who's participated.
Thank you, attendees, for your participation and joining us today. If you have any further questions, please feel free to send them to us at webinar@solvehealth.com. I repeat, webinar@solvehealth.com. If you have any questions related to CE certificate, please send your queries at s.sharma1@solvehealth.com. I repeat, s.sharma1@solvehealth.com. Once you leave today's webinar, you will receive a thank you email within 24 to 48 hours with all the information pertaining to this webinar and how you can earn your CE certificate. This presentation will be available to watch after 72 hours on www.solveinstitute.com. Now I'll tell you how you can earn your CE certificate. You will need to register yourself on solveinstitute.com and complete the short questionnaire and feedback form in order to generate your certificate. Please save in your login credentials for future use. You can access several other existing CE presentations as well, answer the questions that follows, and earn CE certificate for those presentations as well. So you need to register yourself on solveinstitute.com first. Thanks again for participation. We hope you found this information valuable. Have a great rest of your week, and we'll look forward to bring more interesting webinars next month as well. So keep joining us. Thank you and goodbye.